In today's society, smart healthcare has been closely integrated into our healthcare system. When deploying smart technology, where do we find solutions that meet needs? The answer is Health Smart Taiwan. Its extensive service modes provide the latest industry R&D news, in addition to abundant case studies and solutions. HST selects smart healthcare applications that were awarded the National Healthcare Quality Award and incorporates diverse smart healthcare demo sites. HST displays the efficiency of Taiwan's smart healthcare applications. As an industry solutions for healthcare issues, cross-field integrative platform, HST is able to solve key challenges and difficulties of healthcare institutions. HST, your answer to smart healthcare and cross-industry cooperation. In today's society, smart healthcare has been closely integrated into our healthcare system. When deploying smart technology, where do we find solutions that meet needs? The answer is Health Smart Taiwan. Its extensive service modes provide the latest industry R&D news, in addition to abundant case studies and solutions. HST selects smart healthcare applications that were awarded the National Healthcare Quality Award and incorporates diverse smart healthcare demo sites. HST displays the efficiency of Taiwan's smart healthcare applications. As an industry solutions for healthcare issues, cross-field integrative platform, HST is able to solve key challenges and difficulties of healthcare institutions. HST, your answer to smart healthcare and cross-industry cooperation.
Ladies and gentlemen, welcome to International Smart Healthcare Forum. The forum will begin shortly. Please be reminded that if you have any questions to our speakers, please scan the QR code and submit through the Slido for the Q&A session today. Thank you. Good afternoon, ladies and gentlemen. Welcome to the second session of International Smart Healthcare Forum. As one of the highlight forums of Smart Healthcare Expo, today's event is organized by Joint Commission of Taiwan, Taipei Computer Association, and Taiwan Smart City Solutions Alliance, supported by Asian Society for Quality in Healthcare. This forum is an excellent platform for healthcare
Hello
professionals
everyone.
as well as field researchers and practitioners to present innovative solutions and to discover the latest trends in the smart healthcare market. We're excited to invite leaders and experts from prestigious hospitals, universities, and smart healthcare businesses to discuss on the topic healthcare data digitization and innovative medical AI application. Now, it is my pleasure to introduce our distinguished guests today. Joining us, please welcome Mr. Ba-Chun Wang, Chief Executive Officer of Joint Commission of Taiwan. He will also be our moderator for today's session. Next, please let us welcome our speakers, Mr. Fei-Pei Lai, Professor of Graduate Institute of Biomedical Electronics and Bioinformatics, National Taiwan University. Next, please welcome Ms. Miranda Wu, Product Director of Asus Tech Computer, AICS Center. Ms. Guan Hong Guo, Attending Radiologist of Department of Medical Imaging, Far Eastern Memorial Hospital. And Ms. Amy Xiao, Manager of Product Strategy and Management, Acer Healthcare. Thank you all and welcome. We will now take a virtual group photo to capture this special moment. I would like to invite all our guests to please look into your camera, put your thumb up, and smile for us. Put your thumb up, please. Thank you. As we take a screenshot. Ready, set, smile. Thank you. Thank you for joining the group photo shooting. With so many recognized elites in the field, today's forum is certainly expected to be enlightening. To kickstart the forum, Mr. Ba-Chun Wang, CEO of Joint Commission of Taiwan, will be delivering the opening remarks. On top of Joint Commission of Taiwan, Mr. Wang also serves as the president of Asian Society for Quality in Healthcare and Taiwan Society for Simulation in Healthcare. Please welcome Mr. Ba-Chun Wang.
Okay, so good afternoon, everybody. No matter where you are in the world, right now we are facing the new normal during this pandemic. Luckily, the situation in Taiwan is getting much better, but I know that in other part of the world, the disease is still rampant. So I hope everybody well and please stay safe. So we are very happy this afternoon to invite some very important speakers to share their experience in the smart healthcare, especially the solution and the products developed in Taiwan. Everybody knows that the SHE activity right now is the 7th year of this activity. And the Joint Commission Taiwan happily work with Taiwan Computer Association to create and to work together on this forum, because this is very important. We are the nationwide accreditation and quality improvement agents in Taiwan. We understand that the smart solution is very important for quality improvement in healthcare, and it will create the new dimensions of the healthcare in the future. And this is an ongoing process. And I'm very happy that today we have several key speakers that will share their experience. So let's start with our first speaker, my admired Professor Lai. Professor Lai, good afternoon. Professor Lai is a professor in the Graduate Institute of Biomedical and Electronics and Bioinformatics in National Taiwan University, and he's a pioneer in Taiwan's smart healthcare, and he knows the industry and the academic. Is a very important figure in Taiwan and also in the world's arena. So we are very happy to have him to share with us the first topic of today, the development trend of smart healthcare. Professor Lai, please.
Chairman, thank you. Ladies and gentlemen, good afternoon. This is my honor to introduce you the development trends of smart healthcare. Okay, this is the outline. First, I will explain the introduction, and then we will discuss what is a smart hospital and why to be one, and then how to be a smart or intelligent and almost a paperless hospital. Usually, we mean a smart outside and intelligence inside. And then I will make a very brief conclusion. The pandemic put hospital through the ultimate stress test by forcing them to adapt to waves of COVID-19 patients, change treatment protocol, faltering supply chains, and outbreak drove home the importance of advanced technology, especially the ICT, and the hospital that best whether the crisis will by and large the one that were already open to integrating new technology and taking advantage of artificial intelligence data-driven opportunity. Hospitals around the world now have a renewed sense of urgency to provide effective telehealth service, use real-time data to quickly and efficiently allocate staff and other resources for most needed and monitor the flow of patients along care pathway and during the peak demand period. The ability to provide service, monitor patients, and communicate with them remotely proved invaluable during the pandemic, helping patients while they are in their homes can reduce cost, catch more problems faster, reduce infection, and make healthcare more comfortable and convenient. And by shifting rehabilitation to the home means the patient can be reduced from the hospital sooner. Those capabilities will enable hospital to shrink the costly physical facility even while improving and expanding care. Also, machine learning and other forms of artificial intelligence are starting to open up entirely new horizons in care. Clinicians can spend their day watching a stream of patient data, nor can they drop everything to focus on every brick and hiccup turning up in the many data streams from a large patient populations. But a machine learning algorithm can do that automatically for them, filtering out noise and false alarm while funneling useful summaries and critical alerts to the appropriate clinicians or nurses. And then I will talk about what is a smart hospital and why to be one. Generally, the most important foundation of a smart hospital is a robust hospital information system using web-based technology and adopt service-oriented architecture, and also the HL7 standard, especially fires. A hospital that relies on optimized and automated processes built on an ICT environment of interconnected access, particularly based on Internet of Things or Internet of Smart Things, IoT, to improve existing patient care procedures, sustain service in a pandemic, even in war hedge conditions, and can introduce new capability using AI technology. And the objective of smart hospital include, first, enhance patient safety. Second, improve diagnosis, treatment, and surgical capabilities. Also, we like to have a seamless patient flow and also the ubiquitous telemedicine. And cyber resilience also very important for us to sustain our service. And predictability and trustworthiness. Last but not least, we wish to have healthy and happy staff in our hospital. The first about enhanced patient safety. For example, like connected devices collecting data about patient vital signs and medication intake or monitoring lab support machines can lead to increased patient safety if they are able to provide timely warning. For example, like a smart medicine cabinet in the nurse station and smart medicine table, and also the robots for chemical dispensations. Also, we like to provide smart medicine care service for inpatients. We integrate the vital sign and that data, and then we can do the medication adjustment in real time for the safety of patients. And about the improved diagnosis, treatment, and the surgical capability, hospitals are increasingly able to mine patient data to help with diagnosis or choosing the best course of treatment. For example, like using blockchain to manage complete patients' electronic medical record with the help of My Health Bank in Taiwan, an AI portal can also process genes, lifestyle, and environment data to support diagnosis and treatment and even preventions in precision medicines. Seamless patient flow, we like have efficient healthcare as well as patient flow can reduce waiting times and duration of hospital stays. Also reduce error, increase revenues, and boost patient, also employee satisfaction. And ICT can be employed to identify, analyze, and resolve bottleneck, and thereby contribute to efficient healthcare and patient flow. For example, like digital clinics, we have automatic transmission system for outpatient check-in and physiological measurement data. Also, automatic notification of outpatient encounter APP that can reduce the waiting time, and so we can use the data to do waiting time prediction and arrange the patient flow. Ubiquitous telemedicine, one of the key objectives of introducing IoT devices in a healthcare context is the ability to extend the hospital border and provide remote medical care. various medical devices, for example, implantable devices, wearable devices, and other mobile devices introduce the ability to perform real-time patient monitoring through measurement of key vital signs and make this measurement readily available to hospital staff and system via network connection. For example, using ICPR can teach one layman to do CPR correctly to save the patients. And also the post-operative care APP and robust assistance surgery. About cyber resilience refer to the ability of a hospital to ensure the availability and continuity of its service that rely on ICT access. It's very important to have hospital information system do the routine backup and also provide disaster recovery systems. And we must enforce the step to do the cybersecurity guard to provide our information and the system. About predictability and trustworthiness, being perceived as trustworthiness and having a good reputation is a competitive issue in an area where choosing between different providers is an option. Trustworthiness also affects adherence to medication and continuity of care, which has implications for the outcome our hospital can achieve. For example, like e-paper for bedside card and watch. Also, airbox at meeting room, open room, and nursing station can provide a very good closed-loop air conditioning system. Healthy and happy step provide smart watch and smartphone for every step to monitor vital signs, alert and remind, and promote healthy lifestyle, especially very important during the COVID-19 pandemic period. Automatic record keeping from voices to texts is also a major component for a comprehensive AI-supported hospital system. Then, talk about how to be a smart intelligence hospital. There are 5 steps. We better do it step by step. First is digitalization. Then we have data integration and we adopt standard, especially the HL7 standard. And we provide the service through service-oriented approach for system integration and then data mining for artificial intelligence. For example, like every room, every place, and everything connected to internet to become part of digital space. And we must select priority appropriately based on the budget available. First step, digital hospital, including digital water, digital nursing station, digital clinic, digital office, and also provide digital time, okay? For digital water, I think EID is very important, and e-paper on the doorway, and we provide a pad to doctor and nurse, and also pads for patients' use. And digital time and temperature, humidity, CO2 sensor network with accurate and recorder. And we also provide chatbot and patient portal for patient service. We must encourage patients to pay with credit card, easy card, and even smartphone. The key technology driving digital health, like wearable and biosensing device. Of course, telemedicine during the pandemic period. Also, the Florist electronic health record to optimize the clinical workflow and to reduce the workload of physician, nurse. Auto recording and natural language processing is very important, and we must equip with analytic platform and provide with integrated, clean, big medical data. And for patient engagement, we can provide virtual reality, augmented reality, and even mixed reality. In the infrastructure, I think dashboard is very important. From that, we can monitor the status of our hospital information system throughput and the status of server and the switch. Also, business intelligence platform is very good for the administration purpose, and then we can go into AI CTSS, like information and communication technology convergence to reduce costs and improve performance. For example, like provide IP form and to retire private branch exchange. Identification system is a very basic infrastructure component to be a smart hospital, such as tech, bracelet, label, or smart badge. Biometrics scanner for access control. The RFID system with location service or software component to access and monitor relative moment of access patient and the step. Networking equipment provide the connectivity backbone to support smart hospital. The feature is robust routing protocol and much higher bandwidth. The IoT gateway, which further analyze data collected by device, send them to data center or cloud edge computing. A way to create smart hospital. Also, the goal is to reduce energy and water use, improve air quality, boost energy security with low carbon renewable resources. Also very important is to strengthen infectious disease surveillance and control information system. Also, we need a command and control center. This is best done by human and machine working together. And then I will make a very brief conclusion. That supporting smart hospital is supporting yourselves. And digital technology, ICT, is not only the best way for hospital to achieve these goals and to reduce the cost. It may only the only way. Thank you for your attention.
Thank you. Thank you, Mr. Lai, for your presentation. Next, I would like to invite Ms. Miranda Wu to deliver the next presentation. Specializes in AI and big data product planning, digital health solution strategy, and cross-domain communication. Ms. Wu is the product director of Asus Tech Computer AICS Center. Her topic of today's presentation is Catalyzing the Healthcare Innovation by AI Structured EHR and Real-World Data. Please welcome Ms. Miranda Wu.
Hello, everyone. Nice to meet you. Thank you all for joining the webinar today. My name is Miranda. I'm product director from Asus ICE, Asus Intelligent Cloud Service. We are the AI center within Asus. AI for medical service is one of the main core focus. So it's my honor today to be one of your speakers. And today, I'd like to share some ideas about how to catalyze healthcare innovation by AI structured EHR and real-world data. As we know, practicing medicine is becoming more and more difficult, with data potentially overloading physicians. When I visit my family doctor, I noticed that he used his superbrain to unify information about me that was scattered across different systems. And he need to integrate all the data to come up with the right treatment for me. However, when the data grows exponentially over time, it will eventually reach the point where it's beyond a doctor's capability to keep up all the information. And this is the exact reason why AI is necessary for medical services. Our vision is to transform the medical data and build up a medical data highway for AI services and precision healthcare. The first stage is to use AI to clean, standardize, and structuralize all the heterogeneous data within hospitals. Then, on this medical big data platform, AI can provide predictions, early warnings, and diagnosis, the clinical decision support services. Then third stage, we will be integrating more data, including genomics, and work with healthcare providers for a more personalized healthcare experience. And we work very closely with the hospitals for digital transformation. Our goal is to fully utilize data for data-driven clinical insights. So in summary, we use AI to transform data to make the data that was not be able to compute by computer. We structuralize that, and we extract the clinical insights, and we use the data to create a clinical decision support service to help to make the outcome measurable. So we create a positive feedback loop to transform the medical data into a medical information highway. So I'd like to introduce our first medical AI services, Miracle, the Asus ICD-10 AI coding assistant. This solution provides a foundation for medical data to be more structured and to be more standardized. Actually, we want to look at the problem within the healthcare industry. We all know that there is urgent need to improve the efficiency for global healthcare system. Take US as an example. 80% of the GDP is spent on healthcare system, while 12% of the cost is spending on billing and insurance and the coding process. And this is a significant waste within the whole administration process, with a total cost of $200 billion cost for the insurance process. And the shortage of medical coders on the market make the problem worse. We want to have the AI to be part of the solution to improve the overall healthcare efficiency. So you may ask, what is ICD-10 coding? When we feel unwell, we will visit our doctors. During the visit, we tell them our symptoms and our family medical history. The doctors will take medical notes, perform some examinations, and decide the diagnosis and treatment for us. Finally, the diagnosis need to be translated into medical codes for insurance claims and reimbursement. Since the process is quite tedious and complicated for doctors, hospital will typically hire a team of professional medical coders to help with the correction and precise coding for best operational efficiency and revenue concern. So we would use AI to help with the process. Miracle is our AI coding assistant. We use AI to look through the medical notes to recommend medical codes by analyzing the medical records, operational notes, and diagnosis for reimbursement. The AI model is trained over 100 million real-world medical records, and we already use AI-assisted coding for ICD-10 CN and PCS coding system. Our design integrates with the existing workflow for the coders, so it will take them less effort to deal with how to learn a new system. They just keep their original behavior as much as possible. And also, we will integrate the AI model into a positive feedback loop so that the accuracy will continue to improve when coders use our services. As long as the coder use our service on daily basis, the AI will continue to learn and getting smarter while work with the user to make the whole experience better. Under the hood is our state-of-the-art NLU technology, natural language understanding technology. We have a unique alphabet technology with our clinical intelligence attention mechanism. So overall, it will help our model to be very accurate and help the medical coders finish their job. So in most cases, a coder would take around maybe 20 to 40 minutes to complete a comprehensive coding for inpatient's discharge summary. You can see that we integrate our AI service on the EHR system. So with one click, it will launch our AI service. And you can see that our AI be able to analyze the medical notes and provide the recommended codes directly. With this assistance, the same task now only takes 5 to 10 minutes, providing 200% increasing in productivity compared to the original method. So let's take a look at a demo video for how it works.
Let's take a look at the ICD AI coding service. Using a discharge note as an example, based on past codes attributed with this record, myelodysplastic syndrome and liver cirrhosis. Send medical record for AI analysis. After analysis, the AI model accurately predicts pancytopenia with a confidence score of 91%. MDS confidence score is 83%. Together with liver cirrhosis, splenomegaly, and esophageal varices symptoms. To understand how the AI model made these decisions, click on AI Insight, and the keywords relevant to the corresponding ICD codes will be highlighted. The darker the color indicates the level of relevance. This will help the physician understand how the ICD AI model elicits critical patterns from past medical records. From the inpatient treatment procedures, we can see that a patient has undergone an abdominal CT scan. Portal hypertension is detected, but is not included by the AI model. As such, the physician or coder can manually do a search in the search bar. Append K76.6 portal hypertension into the code. ICD-10 CM codes consists of approximately 70,000 codes. We can see that only 2 codes were previously entered, MDS and liver cirrhosis. Through AI analysis, the service will help physicians and coders to select multiple relevant codes with ease and confidence, thereby increasing the hospital reimbursement. Other than full-text analysis, we are able to predict medical codes using our AI models. By selecting the diagnosis progressively, we can see that the AI model is actively recommending corresponding codes. By labeling CC, this will attribute the codes as complications or complications code. This will benefit DRG and increase RW score. Other than CM diagnosis codes, the AI model can also recommend PCS codes. In the operations procedure page, coders can simply input PCS codes instead of manual searching. Medical professionals can now easily select AI recommended ICD codes and complete the medical records efficiently.
So to summarize ICD-10 coding system by numbers, we have now deployed our service in over 19 hospitals with over 650 users who are very satisfied with our service and use our product regularly. And we have processed 480,000 claims encounters, and the service still continue to provide the service. The benefits are increasing the coding productivity, accuracy, improvement of quality of documentation, and also to avoid undercoded cases and increase potential revenue. And as I mentioned earlier, under the hood is our natural language understanding, the NLU technology, to process the unstructured free text physician notes. Our MLU engine extracts information that make the information more structured. It can understand the symptoms, medicine, dosage, body part information on the medical notes. So we use AI to read through the data within hospitals and create AI auto tagging. We would like to index this information and provide a Google search-like experience for healthcare providers. So let me introduce Lumus, our Emr Search System. With the AI auto tagging or auto indexing technology, we can provide experience like a cohort discovery within minutes. By keying simple search conditions, the system can return cohort discovery with distribution in terms of diagnosis, medications, procedures, and lab data. And also, we provide BI and AI insights from the real-world data based on the simple search conditions. And also, we can visualize a patient's journey of his disease and treatment course. So help the doctors to understand the cohort distribution. Also can understand a patient's longitudinal data from his treatment and the disease course. Let's take a look at a demo video for how it works.
The Ai's EMR search can perform patient search based on diagnosis, medication, medical order, age, among other criteria. We will use a clinical research topic by a chest physician as a demonstration. On the screen, we can enter the ICD code, disease name, or abbreviation. For example, enter acute COPD to find all patients with chronic pulmonary obstruction who have had an acute attack. Due to research needs, we excluded patients with asthma and J84 interstitial pneumonia. Click on Search. Based on statistical analysis of the population, the search result indicates 5,823 search patients and a total of 39,406 medical records. Age distribution, gender distribution, use of medication, comorbidities, medical orders performed, visit, section, abnormal lab test results, symptoms are described in the medical records, hospitalization days, and readmission risk. The top 3 abnormal tests are the items this chest physician wants to analyze. There is indeed a clear correlation. Click on the criteria of interest for further analysis. For example, narrow the search results to male patients between ages 60 to 90. Search results and statistics will also be updated in real time. From the updated search results, we can see that the third commonly used medication is sodium chloride. Enable AI sorting. The AI model will automatically sort the characteristics that best represent the population based on the selected search criteria. After reordering the medication, the drugs for respiratory diseases that strongly correlate with COPD are listed at the top. The symptoms extracted by the natural language AI engine from the medical records, such as wheezing, dyspnea, cough, also strongly correlates with COPD, thus helping doctors better understand the population characteristics.
Okay, so from the demo video, you can see that we like to create a Google search-like experience to transform the real-world data to real-world evidence for clinical research. We will support retrospective cohort study. In the past, physicians may be struggling in testing a hypothesis within a short period of time. Lumus, with richness of EHR, can help to generate the retrospective cohort data very quickly. Also, we can support the physicians to find the match and comparison cohort. We know finding the match cohort appropriately to match the appropriate controlled cohort could take a lot of efforts. Lumos can easily search for patients within time with a time relation for further analysis. And we can also support clinical trial. Lumos can save the tested and controlled subjects and return the search for checking the trial status. And all of this is under the hood our AI technology to help to auto-indexing the hospital data, to help to transform the real-world data to real-world evidence through clinical research. Here is a summary page of our AI medical search platform. The first layer is data layer. We use AI to do big data cleansing and integration layer. And you can see that we integrate all the structured and unstructured data and integrating internal and external data, including the wearable device, genomics data, and also some like a healthcare checkup data or the information user input within their apps. The second layer is AI model layer. We do big data auto-indexing, AI model analytics. So on top of this platform, we can enable AI service on this AI service layer, including clinical decision support service, ICD coding service, EMR, drug safety, or we can integrate more API even with third-party service. We want to unleash the power of big data. So to apply the AI service more quickly on this AI service layer, while supporting external and internal source and applications, our vision is to transform the medical data and build up a medical data highway. And in this way, we work with hospital for AI-powered digital transformation. So in summary, our vision is to transform the medical data. We are very excited about AI for medical service. Our vision is to unleash the power of data, which is the power of doctors, as data-driven collective intelligence. We believe human with AI can be a strong digital workforce, and we are looking forward to more collaboration opportunities and to help us to work with us to unleash the power of the data. This is my end of my presentation. Thank you for joining me. And you have any questions or any interest in knowing more about AI service, you can find me in this email.
Thank you. Thank you, Ms. Wu, for your sharing. Our next speaker, Mr. Guanhong Guo, attending radiologist and clinical assistant professor in the Department of Medical Imaging of Far Eastern Memorial Hospital. Mr. Guo also serves as a radiology lecturer in the Faculty of Medicine of National Yangming University. Today, he's going to give a presentation on AI-assisted active alarm, an auto-reporting system of chest X-ray. Please let us welcome Mr. Guanhong Guo.
Hello everyone, I'm Dr. Guo Guanhong. I am a radiologist from Far Eastern Memorial Hospital in Taiwan. I'm gonna talk about the smart chest X-ray AI system developed by FEMH Hospital and our partner Quanta Computer. The chest X-ray AI system is designed for radiologists in hospital. Let's start from the background first. Please look at the figure. These are numbers of different radiology examinations of our hospital. You can see the red bar. Okay, red bar here, it's a chest X-ray. It's around 181,000 examinations in a year, which is the largest number, the dominant one among all these exams. Too many chest X-ray exams can make radiologists exhausted. Besides, there are some other radiology modalities such as CT or MR which are more expensive, bigger reward, or maybe more challenging, okay, to doctors, which makes chest X-ray less attractive to radiology. Just above all, can lead to poor reporting efficiency. Delays in report can possibly lead to delays in the management of some patients who have emergent conditions. And the most scenario could be the increase in the medical dispute or malpractice claims. So, if human radiologists don't like to do it, maybe the AI can help. To address above-mentioned concerns, we built an AI system with two modules. The first module aims to decrease the missed or unreported chest X-ray of emergent or important clinical conditions. AI will pick them up and actively inform the doctors by alarm. The other module targets to large amount unreported chest X-ray and aims to improve the reporting efficiency. We built a module with AI-assisted auto-reporting to help doctors to increase their efficiency. Okay, let me introduce the active alarm first. The module detects for emergent or important diseases, including fresh pneumothorax, pneumoperitoneum, fresh lung mass, and malposition of endotracheal tube. You can see two diseases with fresh. Okay, fresh pneumothorax, fresh lung mass. Fresh means the first time. Okay, the first time, the fresh pneumothorax. Of course, we need an alarm. However, post-treatment follow-up image, no alarm is needed, right? Okay, lung mass means tumor. Okay, fresh lung tumor. Of course, we need an alarm. However, if tomorrow tumor is still there, next month tumor is still there, so no more alarm is needed. Then it's called a smart alarm. We have considered the alarm, the alarm flow, the informed doctors, the patient privacy protection, and the convenience. The average alarm time from exam time to radiologist is around 10 to 15 minutes. Doctors can receive alarm message from PC, pad, phone. Okay, here I use phone for demonstration. Doctors, okay, beep 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 beep. Okay, doctors get alarm message. Okay, just like this, a screen like this. And the first thing to do is VPN login. Okay, a screen like this for authorization. And then there will be a link here. Okay, just click the link. It will open a web-based DICOM viewer to check the image. If needed, the doctor can call the patient back as soon as possible. Given that the alarm is so quick, that the patient may be still in the hospital. This is the result of active alarm. The system has been online since February 2020. On average, we have 15,000 cases in a month of our hospital. This slide showed the real performance of the AI alarm system for the 4 diseases of interest. For fresh pneumothorax, as example, the sensitivity is 0.8 and the positive predictor rate is 0.4. The specificity and the accuracy are both over 0.99. The model looks quite good so far. However, doctors care more about the clinical values, including their time spent in false alarm. We have to know that AI is not always helpful. It has cost. What is the cost? Okay, it's the false positive to waste doctor's time. Let's do some simple calculation here. Take pneumothorax for example. Doctor receive 13 false alarm from AI system in 1 month. Let's say that check one alarm takes 3 minutes, then AI costs total 39 minutes. 39 minutes of doctor's time in 1 month. Okay. On the other hand, 9 patients get earlier diagnosis when they might have been missed or undiagnosed if AI alarm system is not available. Okay, the average reporting time in our hospital is 10 days. Now you can get earlier diagnosis in about 10 minutes. 10 days become 10 minutes. Okay, for 9 patients, so it total 90 patient days earlier diagnosis. Okay, therefore the time cost is 39 minutes of doctor working time in return for the earlier patient diagnosis of 90 days. For endotracheal tube malposition, 13 minutes in return for 67 days. For fresh lung tumor, 9 minutes in return for 132 days, and for pneumoperitoneum, 4 minutes in return for 15 days of earlier diagnosis. So I think the active alarm is actually helpful. Okay, I am gonna show you some demonstration of real case. For example, AI got 18 pneumothorax cases in 2 months. Okay, just in February 2020. Okay, here in this time interval, 18 cases are detected by AI. Look at the right side. There are 9 of the 18 pneumothorax cases detected by the AI system. These images looks quite normal. Can you see where the pneumothorax is? Where the pneumothorax is? I think this case, okay, here. Okay, this case maybe okay here, and this case here. Okay, I have to say that it really looks quite normal and quite easily missed. Half of the AI detected case are quite easily missed. Actually, I personally got many calls due to the pneumothorax alarm system. Many clinicians called to say thank you because these cases are easily missed. Okay, active alarm is good, but it's a quality improvement tool. Quality improvement tool helps patients, but now we want to help doctors as well by providing a productivity tool. How to do that? By auto-reporting. What is auto-reporting? Okay, every image comes in, every report goes out. Okay, this auto-reporting. Of course, it's not pure auto, it's AI assisted auto-reporting. Doctor need to recheck AI report and confirm the report. The idea is that if the report is correct, just a click, it takes like seconds for a report. You can send it immediately. It decreases a lot of time. If there are some mistakes, it's okay. Sometimes AI make mistakes. Okay, usually the mistakes is not many. Doctor can correct and modify the report in the system. The process is still faster than without AI system. So overall, using AI is faster. Besides, the view of AI is different from human eye. So usually human misses when AI don't. And of course, vice versa. But okay, AI can doctor. Okay, they really can help each other to increase the report accuracy. So the productivity tool, okay, doctor plus AI assisted auto-reporting can improve a lot in reporting efficiency. And also it can improve a little bit in reporting quality, okay, the report accuracy. Productivity tool is much more difficult to develop. It needs more models. We built 4 models for active lump. I mentioned the module before, but we built 33 models for auto-reporting. Here I want to mention another thing. There will be more and more AI online, and the GPU computing power, the internet bandwidth, and the electricity are limited. In the type of quality improvement AI, computer calculates 10,000 times to get 20 or 30 positive cases. Okay, the CP value is not very high. However, in the type of productivity AI, both the positive and the negative AI predicted results will contribute to the final reports. It makes no waste of every calculation. So I think productivity AI is superior to quality improvement AI. Okay, we should pay more attention to this kind of AI. Okay, finally, as a radiologist myself, also a designer of the system, I worked hard to make the system clinical oriented. Every image comes in, every report goes out, one stop, end to end. The system is deeply integrated in the RIS and the PACS system, and it's doctor friendly. No need to change reporting habits, and it has many customized functions. Okay, so let me show you the auto-reporting module of AI system. Because of the time limit, I just show some screen captures. There are screen captures of 2 monitors. The left side, the blue one, is RIS system. It's radiology information system. It's for doctor to get the patient data and the patient list. Okay, it's different among hospital. And here is the work list. Click the patient list. It will call on the right side, the right monitor, the black one. This is the system we built. This is the AI system. Okay, in the monitor, on the right top, it's a DICOM viewer. Doctor can, it's an image, DICOM image viewer. Okay, doctor can zoom in, zoom out, and adjust the brightness and the contrast of images here. The viewer is developed by us. It has 2 advantages, which I will discuss it later. On the right bottom, at the right bottom, it's an auto-reporting window with finding here and the impression here. The speed of auto-reporting, just like this. Pop, okay, pop, pop, okay. Image change. Okay, image shows the report. The report shows simultaneously, like this. Image shows, report shows simultaneously, like this. It takes nearly no time to produce a report. It's so fast. Okay, on the left top, they are disease buttons. Including major diseases of chest X-ray, such as mass nodule consolidations. There will be warning signs on it if AI detected abnormality in this item. A warning sign like this. Okay, when the mouse cursor moves over the button, the DICOM viewer will dynamically overlay the box of the abnormal lesion on the image. Okay, like this, like this. I just mentioned 2 advantages of our DICOM viewer. The first is fast. Showing image is fast, and the auto reporting is also fast. The second one is the dynamically overlay the annotation. You can see only one abnormality box one time, instead of showing all abnormal boxes together. And on the left button, there are function buttons such as previous and the next case and confirm here. I usually set the next and the confirmed hotkey as hotkey on my mouse. So I just need to press next on the mouse and press confirm on the mouse to send the report. I don't need to use the keyboard, just use the mouse to type the report. Okay. You can also click the disease button. It will open a sub-level window of structure table editor of all diseases. You can see some minor disease here, the disease location setting here. If the auto report is not satisfactory, you can just open the editor, modify the checkbox, and the report will change accordingly. Here is the result of auto report. Our team ever participate cargo eyes in the AI pneumonia competition, and we won good grade, which approved our modeling ability. The system has been online for more than 3 years. AI assisted reporting for more than 220,000 images, and we collect the feedback from user for more than 300,000 images. AI increase the productivity. What's the number? For our practical experience, half of the reports can be confirmed directly, and it can double the productivity. For example, I used to report manually I used to report 150 chest X-rays in 4 hours. Now with the help of AI, I can report up to the 300 chest X-rays. Okay, in conclusion, we built a smart chest X-ray AI system targeted for emergent or important chest X-rays and for large amount unreported chest X-ray. For the first one, we built an active alarm module to detect emergent or important diseases and give alarm. And for the second one, we built an AI auto-reporting module to help increase doctors' efficiency and productivity. The characteristics of our system is it's a medical AI product. It's highly clinical oriented, and it has been clinical tested for 3 years, and it's deeply integrated. It's fully automatic, one-stop, and doctor friendly. Okay, here this is my speech. Thank you very much.
Thank you, Ms. Guo, for your presentation. And now please join me to welcome our last speaker of today, Ms. Amy Xiao. Specializes in biomedical sciences and digital health, Ms. Xiao works as the manager of product strategy and management of Acer Healthcare. For her presentation, she will share under the topic, improving the quality of diabetes care through VeryCDR, an AI diagnostic software for diabetic retinopathy. Please welcome Ms. Amy Xiao.
Thank you. Good afternoon, everyone. I'm Amy from Acer Healthcare. So today, I'd like to give you an introduction to our AI software, VeryCDR, for the screening of diabetic retinopathy and how that helps improve the quality of diabetes care. So before we begin, here's a brief introduction to Acer Healthcare. So we're a subsidiary of Acer, the company that sells computers, and our mission is to improve human health and well-being through artificial intelligence. So specifically, we'll collaborate with hospitals to identify unmet medical needs, utilize AI and big data analysis to develop intelligent medical products, and provide AI-driven solutions to improve patient care and outcome. So VeryCDR is our very first product. It's an award-winning diagnostic software that utilizes AI to analyze images of the retina for signs of diabetic retinopathy, or DR. And the target audience is diabetes healthcare professionals. VeryCDR assists healthcare professionals, especially doctors who are not eye specialists, to interpret the images. So what exactly is DR? DR is a complication of diabetes caused by high blood sugar levels damaging the back of our eyes. And there are usually only minor or no symptoms in the beginning, but could lead to blindness if not properly managed. But fortunately, blindness is preventable with regular annual screening. And currently, over 400 million people worldwide have diabetes. It's estimated that 1/3 of all patients with diabetes will eventually develop DR over the course of their lives. While annual screening is recommended for all diabetic patients, in reality, only less than 50% of patients get screened, even in the developed world. So this low screening rate is due to a number of challenges. First, there's a worldwide problem of shortages of ophthalmologists. The doctor-to-patient ratio is in the order of 1 to thousands. And this then leads to the problem of overworked ophthalmologists and delayed reports. In addition, DR screenings are often done at diabetes clinics, but diabetes specialists may not be trained to interpret the eye images. So this is where VeryCDR comes in to overcome these challenges. When in action, VeryCDR assists doctors to make diagnosis of DR from diabetic patients' images and provide immediate results on referral recommendations. And specifically, our software VeryCDR is to be installed on the computer that's connected to the fundus camera. And it can be configured so that as soon as it detects that a new image has been taken, it will automatically start the analysis and output a referral recommendation within 3 to 5 seconds. And it has an accuracy of 93%. And this accuracy was validated through a formal clinical trial conducted at National Taiwan University Hospital. So VeryCDR reached a sensitivity of 95% and specificity of 90%. And such performances are comparable to that of ophthalmologists. And in terms of regulatory approval, VeryCDR was the first ophthalmic AI software to obtain Taiwan's FDA approval in September of last year. And earlier this year, we further obtained Thailand's FDA and Indonesia FDA's approval. We're currently in the process of applying for other Asian countries. So later this year, we also expect to receive approval from Vietnam. And in 2022, we expect to receive approvals from Malaysia, Philippines, and Japan. So next, I will go over how VeryCDR works in an actual user workflow. So typically, VeryCDR is installed on the computer that's connected to the fundus camera. And usually, as soon as the fundus images are taken, they will be exported and saved in a designated folder. So we can configure VeryCDR to automatically detect new images and start to analyze the images in real time. And after it finishes the analysis, a report will be generated automatically. So basically, in such scenario, we can configure VeryCDR to work in the background so that the user doesn't ever have to manually upload the images for the AI analysis. So it's like you will already have the recommendation result in a few seconds after the patient's images are taken. And during the automated process, all images will first go through an image quality control step. VeryCDR has learned from the experience of ophthalmologists. So if the quality of the image is at least fair enough for ophthalmologists to analyze, then VeryCDR can analyze the image. However, if the image quality is so bad that even human ophthalmologists cannot analyze, then VeryCDR will output a bad quality image. And the default recommendation would be to refer to ophthalmologists for further analysis. So with the system in place, we can ensure that the image quality is checked before the patient goes home. And I just mentioned that VeriCDR can be configured so that everything can be automated and the user simply just sees the report. But if you prefer to manually upload the image for analysis, we also have a very simple and user-friendly interface. So on the left, you may choose the one eye icon, and after you upload your fundus image and hit the analyze icon, you will see the result shown here in the dial. So green means that the patient only needs to come back for regular tracking and corresponds to no DR or mild NPDR. And if you would like to have a report, you can also hit the create report icon, type in additional comments if you like, and generate a report like this. So this is, so here I would like to highlight the key features of VeriCDR. So first, VeriCDR uses edge computing, so it can do the analysis without requiring the internet, and you don't need to upload the images to the cloud. So there's no data privacy concern here. And second, VeriCDR has a built-in backup program that automatically protects your data when AI is down. So you don't need to worry about losing your patient's images. And third, VeriCDR can be configured to integrate seamlessly into your current clinical workflow. So we also offer customization services as well. So adopting VeriCDR doesn't complicate your work, and it's here to simplify your daily routine. And finally, VeriCDR offers unparalleled performance with an overall accuracy similar to that of specialized ophthalmologists. So in the next section, I would like to go over the impacts of VeriCDR in the real clinical setting. So the original patient journey of a medical center in Taiwan is illustrated here. You can see that there are quite a lot of pain points. When a diabetic patient needs a DR screening, typically an educator or nurse first takes an eye image for the patient. And without any mechanism to check the image quality, the patient then goes home and the image is left in a huge pile of cases waiting to be graded. And with an average of 1,500 patients per month, the team of diabetes specialists would have to finish grading around 45 reports per day. And since diabetes doctors are not eye specialists, they may not be trained to interpret eye images, and it takes an average of 3 to 5 minutes to grade each image. And the patient would not receive the results until they return for their regular diabetes appointment 3 months later. So if the patient is recommended for referral to an eye specialist, same-day eye appointments are almost impossible to book. So as a result, the patient's referral to eye specialist is delayed, and therefore treatment is also delayed. And this medical center further risks losing the patient to external eye clinics. So this is where VeriCDR comes in and provides a solution to each of the pain points. We co-work with the medical center's IT department, Division of Endocrinology, and the Division of Ophthalmology to customize and integrate VeriCDR with the hospital's HIS and PACS system according to their requests. We can customize this so that VeriCDR results are automatically displayed in PACS, as well as already pre-checked in the patient report form. So basically, we can achieve seamless integration of AI into the original clinical workflow, so healthcare professionals do not need to change their routine. So after implementing VeriCDR into this medical center, for about 1 month, we analyzed the preliminary data collected. By randomly selecting around 300 cases, we found greater than 90% agreement between the already pretty elite team of diabetes doctors and VeriCDR. So such high level of agreement adds confidence to less experienced doctors, which in turn reduces the time it takes the doctors to interpret the images and accelerates the diagnosis process. And specifically, VeriCDR reduces the time it takes to interpret each image from around 5 minutes to less than 1 minute. And it's an 80% reduction. So by saving time on interpreting the images, diabetes doctors can have more time for patients. So in the new patient journey, VeriCDR provides an image quality check system to ensure fundus images are readable by doctors. It increases the confidence of diabetes doctors in diagnosing DR. The interpretation time is greatly reduced, so the doctors have more time for patients and can offer better quality of care. And finally, by optimizing the entire DR screening efficiency, high-risk patients can be identified earlier, so they can be referred to ophthalmologists for treatments earlier. And here is another study of VeriCDR at Taichung Veterans General Hospital in Taiwan. So here, VeriCDR was compared with endocrinologists, and we found that VeriCDR's specificity of 84% is significantly higher than the 50% of endocrinologists. We also found that VeriCDR decreased the possibility of overdiagnosis by endocrinologists, and it increased the rate of finishing grading the reports on time. And the results have been published in the journal Life earlier this year. So the implementation of VeriCDR into real clinical settings has already brought positive impacts to the healthcare sector. It not only improves the accuracy and speed of screening, provides early diagnosis and treatments to patients, better prevents disease progression, but most importantly, it improves the quality of patient care and achieves better patient outcome. So in sum, VeriCDR was carefully designed and innovated to meet the specific needs of the medical community and address the challenges of our DR screening. With our unique product features combined with customization, we've made adoption of new digital technologies in the medical community much easier. And in the real world, VeriCDR's accurate and immediate analysis results are already helping healthcare professionals. So as we continue to roll out VeriCDR around the world, it's expected to make a greater impact and bring unparalleled values to healthcare professionals, providers, payers, and patients alike. So with that, I'd like to conclude my presentation today. So thank you, everyone.
Thank you, Ms. Xiao, for the presentation. It was such a delight to learn from the leading players in the field of smart healthcare. And now it is my pleasure to convene all the speakers today to join a panel discussion moderated by Mr. Bachun Wang. For our online audience, if you have any questions, please scan the QR code on the screen and leave your questions in a Slido for the QA session. Thank you very much. Now we're going to invite all the speakers to join us today. Mr. Wan, the floor is yours. Thank you.
Okay. So thank you for our 4 speakers. Very nice talk. I think so. We have a lot of things to discuss during this panel discussion, because I see in my screen that there are 5 questions, and for this session we have about 20 to 25 minutes left. So I think we will quickly go over all the questions, and I hope all the speakers can control the time. So I will read the first question for Ms. Wu from Asus and also Ms. Xiao from Acer. Okay, so this is a question from Thailand, Mahidol University. So are there any accomplished AI structures data of citizen in health system? If yes, what field it is used for? So can you answer this question?
Okay, maybe I'll jump in and answer this question first.
Okay.
Yeah, and the answer is yes. I think for clinical research, some obvious application is the doctors may want to find a cohort for smoker or non-smoker, and this kind of information, if it's not stored in structured field, this is something AI can help. And another application we do is we work with the cancer registry input. In the past, the hospital need to hire a register to look through the medical notes for cancer patient and to identify the specific side factors, the critical information from medical notes, and manually input that system into cancer registry. And this is something that AI can also help. So what we do, we use AI to read through the physician notes and to identify the important information, the site specific factors, and ask the register to do double confirmed. So they can help them to finish the job very easily within a short period of time. And this is something we do with Taiwan Hospital right now.
Okay, so Ms. Wu, you like to answer this question, related to your topic?
Okay. Maybe Mr. Amy Xiao can.
Ms. Amy Xiao, Ms. Xiao, I'm sorry.
Yes.
Yeah. So actually, my company focuses on medical imaging. So it's actually considered non-structured data. But I believe AI structured data definitely has a lot of applications, such as like Ms. Wu just talked about. I think it has a lot of potential in the field of oncology.
Okay. So let me add something. In Taiwan, we do have some structured database, for the researcher to apply for research or even for commercial purpose. So our national health insurance data, you can apply to use this big data. And although some big hospitals, they have combined some of their own databases and open to use for the researcher or physician in their hospital. But however, this is not widely open to the public. But we are doing the infrastructure database work. I think that's very important for the development of AI. Okay, so let's go over to the next question for Professor Lai and also Dr. Guo from Thailand, also the Mahidol University. What are the ways of growth for AI-driven innovation or implementation in healthcare system? So I think this is a big question. So why don't you just go over quickly to answer the key points of this question. Dr. Lai, please.
Sorry, can you repeat the question again?
Okay. What are the ways of growth for AI-driven innovation or implementation in healthcare systems?
Okay.
就是 AI 最主要在健康照护方面，它应用跟发展会在哪方面
Okay, thank you. Okay, this is the first application area, especially in image, as demonstrated by Dr. Guo, because the image is much easier compared to the free text. So the electronic medical record will be the second phase for the AI application. And then the third phase will be on genes data and environmental open data and lifestyle data. It's because it's a huge, tremendous amount of data, make it a little bit difficulty to properly process now, but it can be done in the near future. And I think the last stage is about the process of protein, that is to describe the micro behavior of our human, and you can say it's kind of human simulator. So now there are plenty among our applications successfully got the approval of FDA as you can see, one example is from the Asus. They demonstrate there's application, and there are so many plenty of application. Most of it is in image and also in electronic signal, like AI approach to decipher the meaning of EKG and ECG, something like that. Okay, that's my answer for your question. Thank you.
Okay, thank you, Professor Lai. So, Dr. Guo, please.
Hello, I'm Dr. Guo. My interest is medical AI. I think in medical AI, there are two ways AI can do. The first thing is AI-assisted clinical diagnosis. And the second thing is AI can predict a trend from big data. Though I'm introducing a clinical assisted diagnosis system, but I think the later one, the predict trend, is more powerful and it's much easier to achieve. For example, let's say we build a COVID-19 pneumonia model. In clinical practice, the model should be very, very precise to go into the clinical. But if we want to use it to predict the trend, the model has good relation, okay, with the with the COVID disease. Not 100% precise, but maybe 70, 80 accurate. It's good enough to predict the trend. We use the model to from previous big data, then we can predict if there is a outbreak of COVID. I think this is a more powerful way to use the medical AI. That's my opinion.
Okay. Thank you, Dr. Guo. Thank you, Dr. Guo. Right now, the image analysis is very popular in the AI field. And I think Dr. Guo's hospital not only used AI to analyze the image to develop different model, but also they have some business model because their team won the National Health Quality Award of Joint Commission Taiwan last year because they find how to use this technique to effectively save the time for radiologists. So they give the meaning to the technique. So I think this is very important. So we not just AI for AI. You need to have AI for something, for some purpose. So I think it's a very good example. So I encourage you to move on this direction continuously. Okay. So the third question is also for Professor Lai, also from Vietnam National University. So the question 3 is, could you elaborate specific AI technique for ubiquitous hospitals? Professor Lai, please.
Okay. I think first we should get started with the image process. It's kind of simple because all the images are generated by machine and they follow a DICOM standard, and they are very efficient, like a CNN architecture to process all the images. Okay, and then second step, we are going to the electronic medical record because all the record, most of that were generated by physicians, by humans, and there's so much different between each physician in terms of their completeness and the quality. So I think the next step is the EMR, and I think we should set a priority according to the needs of the care team. Like based on the priority of the care team, like how much amount of time can be saved, or how much the patient's care quality can be improved. Okay, I will talk about some example done in National Taiwan University Hospital. We have several image application like dermatology and also some brain tumor segmentations. And actually, we also have a similar application like Asus provided, like ICD-10 auto coding that can save a lot of time and effort our coder, and also improve the quality and increase the reimbursement rate from our national health insurance company. And I think the most effort we are doing is we want to provide a precision health infrastructure. So cooperation with the the genetic medicine department, we engage in a research on genes, variants, disease relationship application, and we also practice the wearable device that we provide the patient with a smartwatch and some app in smartphone, in order we can understand the lifestyle of the patients. And plus the open data provided by our government, we can have its environmental data like the air quality, the humidity, the temperature, and with gene and environment data and lifestyle, plus the electronic medical record, we can do something like a patient like me, in order to provide a very precise and predictable capability for the treatment of the patient. So that's the effort we are doing now. Okay, thank you.
Okay, thank you. Yeah, thank you, Professor Lai. So I think the industry are all very anxious, how to quickly deploy all this technology in the field, and what solutions are really feasible and can survive over time. So that's the question we like to know about, and I think the time will give us a test and show us what is a killer solution in this AI era. Okay, so next go to next question is for Ms. Wu of Asus. So the question from Vietnam National University. So in Vietnam, most hospitals face with non-structured EHR data. So do you suggest any AI system to deal with those data in data warehouse? Please.
Yeah, the answer is yes. Like the example I just mentioned, take cancer registry, for example. We will use AI to read through the medical notes from cancer patient and help the register to find the site-specific factors. So I would suggest, because it's also about the data quality, so I would suggest to scope down the problem you are looking at to define a clear data problem. Maybe you want to analyze the data from lung cancer patient. Then we can scope down that specific data problem and use AI's technology to solve that problem.
So I think we can continue on question 5.
Okay.
Because they ask what's the difference between the Miracle and the Watson. So it looks very similar. So what's the difference? So will you consider edge AI usage instead of cloud AI? And about the language, how many language can the Miracle analyze? So if their medical records are not written in English, can your system read their language? Please.
Okay, so I'll answer the first question. What's the difference between Miracle and Watson? I think we all understand when Watson started to enter in the market, it gives a lot of high expectations. There are some articles talking about how Watson maybe will be have better performance than doctors, or would have replace doctors in diagnosis. But this is not something we do. We analyze the past data created by the past for the physicians. So we actually use AI to create data-driven clinical insights. It's like to organize the past information and create a collective intelligence from all the physicians, and use that data, that information. We support physicians to do a better decision, a better well-informed decision based on the past data. So we won't do something that we won't claim that we are better than doctors. We actually help them to organize the data and give the data back to the doctor to let them have well-informed data to have the power to do the final judgment. So that's what we do. And also for the Edge AI usage and cloud AI usage, we want to create like internet within the healthcare system. So any data source from Edge AI or from cloud AI, that's going to be going to the data warehouse and will be part of the data source to create the AI solutions. So that's what we do. And how many languages can Miracle analyze? Actually, the under-the-hood technology for Miracle is the state-of-the-art bird language model. So it's actually could take care to deal with various different language. And right now, we can take care of English and Chinese, but our main focus is still English. So to answer that, our model is language agnostics. We can deal with various language, but right now our main focus is English and Chinese. Yeah. So how do we have real use case in Taiwan? Actually, we have deployed over 19 hospitals in Taiwan. And a lot of users, over 650 users, use our product on daily basis. And we have shown a great adoption rate and high accuracy to help them to complete their work. So we have seen the real use case from Taiwan and believe AI assists human to become a new digital workforce to complete the task. Thank you.
Okay. It's a very good answer, but I want to add something, add some notions of my own opinion. Firstly, it's very important because I think the industry have to think the real clinical process, as a physician. All the physicians, they don't like to hear that you are creating something, try to replace their expertise, okay? So you need to tell them that, I create this machine that can help you to improve your efficiency, okay? So what happened in the coding problem is not doctor don't know how to do the correct coding. It's because they are too busy,
Yeah,
so
exactly.
so they may not have enough time to trace back all the patient's history, okay? So they will forget. They only focus on this admission, this hospitalization, okay? They forget to put all the patient's past history, all the informations into their medical records. So the machine, the Miracle can help, if you can trace back to look into the health information system in the hospital, they can help physicians to save their time. So if you approach through this way, your system will be very popular. So, but if you are talking how to replace the expertise, I think all the physicians will be very, very upset. Okay, that's the first question. And the second question, the Edge AI or the cloud AI. So I think it's a very important issue right now, in Taiwan or in everywhere is the security of the data. So I think the industry and the hospital, they have a very different view because of how to secure the data, because they want to keep the data in their own firewall, okay? So if your computation machine is way on the cloud, so they probably, feel very uncomfortable to upload their data into the cloud. Okay, so that's a key feel, in their mind. So you have to think how to solve this problem. Maybe the federal learning or something else, can solve the problem, or the regulation can help on this matter. Otherwise, that's a big barrier to popularize this machine. The miracle is a very good idea, but there's some barrier. And the third one, the language, So I think the most important thing is that the country, okay, they need to have a very good translation of their language to the ICD-10. If they have a comparison table for all the disease name and between ICD-10 in English and their own language, so I think it should be very easy for your program to read, to analyze the data. Okay?
Yeah,
okay.
Thank you.
Okay. So the last question. So I think we have just 5 minutes left. So I have the 6th question for Dr. Guo. Regarding the Quanta chest X-ray AI chest, what is the input equipment of real-time chest X-ray of the patients? Please, Dr. Guo.
Okay. Actually, I'm not quite sure about the questions. The equipment, you mean the machine? Okay. We have collected 10 years images from our hospital. So if you ask the machines, the brand, including like Toshiba, Canon, Siemens, like this, and we collect DR, CR images, both, and portable, common, routine chest X-rays. All we didn't exclude images, supine view, standing view, all include. Or if you care about is the real-time image input, I know there are two processes of doing real-time job. One is the push. The machine capture the image and the push to the AI directly. And the other process is loop query. The image is sent to the PACS first, and then the AI system will query the images for some interval, and we use the second one. We query the images every 5 minutes, and including the loop time, the calculation time. Actually, the AI calculate 33 models, only take maybe 3 minutes, but we don't use the active push way because it will let the GPU to compute frequently, and just for very small case and calculate too frequently, I think it's not good. So we use the loop, and so it makes the alarm not that real time, okay? Or it can be pushed to the limit. It's maybe 3 minutes, we can get the alarm. So combine the loop time, the calculation time, and the alarm delay time. So it's 10 to 15 minutes delay. So this is my answer.
Okay. Okay. So our time control is quite perfect, So right now I have 2 more minutes for me to do the closing. So thank you for our 4 speakers and all the audience. The Health Smart Taiwan platform is a platform provided by Joint Commission Taiwan and also sponsored by Taiwan's Ministry of Health and Welfare. So this is a window of Taiwan's smart healthcare solutions. So we welcome all the manufacturer industry partners to register on this platform. So this is our channel. We will provide all the information to maximize our exchange of ideas. And we also welcome all the international partners to visit our site from time to time, to visit the remarkable achievement of Taiwan's smart healthcare solutions. Yeah. And also, all the partners in the HST platform, we encourage you to participate in JCT's annual National Healthcare Quality Awards. So that's a competitions for all the smart healthcare solutions. You need to prove that your product is feasible in the field, in the hospital, and can provide very obvious improvement data in the field. So that will stimulate you to think. So your product is just not only a product. You will think how to fit your product into real healthcare process. So that's very important. This is a very competitive award, and I encourage all the partners, you can consider to join our annual activity. This year, because of the pandemic, we extend the registration deadline to end of August. So you are welcome to visit Joint Commission Taiwan's website and look for more information. So I thank you all for joining this very wonderful occasion. Thank you. Good afternoon. Bye-bye.
Thank you, Mr. Wan, for moderating this rewarding discussion for us, which has concluded our forum today. Our best wishes go to all the speakers and the online viewers around the world. Ladies and gentlemen, in order to present better events in the future for you, please scan the QR code and fill in the questionnaire, as your feedbacks are very important to us. Thank you very much for your support. The next session of International Smart Healthcare Forum will be taking place on August 26th at 2 p.m. Taipei time. Please stay tuned to Smart Live on smartcityonline.org.tw. Thank you, and we hope to see you again next time.